Good morning. Steve Stites here at the University of Kansas Health System in the Dolph Simons family studio, and welcome you to this cold, snowy Friday here in April in Kansas City.
It's bad.
Yeah, that's kind of a funny deal. You know, COVID's bad enough, but to get snow on April the 17th or whatever today is, good golly, Miss Molly. So we are joined today by Senator Jerry Moran, a good friend of the University of Kansas Health System and a great friend of Kansas, who is here. I don't know if you're from your home today or from D.C., Senator. I guess we'll find that out in just a minute. As well as Lee Norman, Dr. Lee Norman, who is the secretary at KDHE. Senator Moran, are you with us? Are you there?
Dr. Stites, I am here, live from the basement of the Moran home in Kansas.
Excellent. Well, I know you're getting good care there. So how are you doing?
I'm doing fine, thank you. Thanks for asking, and hope Kansas are doing better every day.
Great. And Dr. Norman, are you there?
Yes, I am. I'm in my office. Thank you.
All right.
Good.
And of course, I have Hawkeye here, Dr. Dana Hawkinson, and Michelle is our interpreter this morning. So thank you all for joining us. Senator, let's turn to you first. What words of wisdom do you have and thoughts that you would like our listening audience to hear?
Well, there's certainly a significant increase in the amount of conversations about a path forward as far as the isolation, the stay-at-home orders. Been a topic of conversation in Kansas, but across the country. Yesterday, Trump held a telephone conference call with Republican and Democrat members of the United States Senate, in which he indicated that they were working on a plan to present as a guideline for states and communities to utilize. And there was a bit of that release last night, just in broad terms. I'd be interested to hear what the doctors on this program have to say about it, but it appeared to me to be something that is reasonably common sense. And I think the major point, communities, localities, states are all different. And that's been one of my views for a long time, is that Washington, D.C. is not to make perfect decisions for every place in the country. And so a lot of necessity, in my view, in but certainly in this one, as we look at how we return to a more normal state, that decisions be made closer to home than all of them being made in Washington, D.C. And so guidelines that seem to be developing, again, I'll see what the medical professionals have to say this morning, but that's a development. And I would indicate that I also had a personal call with the president, plus a number of my colleagues one-on-one throughout the last week. And I continue to promote testing. I think it's one of the ways that we can move more rapidly to get things back to normal and less isolation than what we have today. We need more information about more people, and a goal of ours should be testing. The president did appoint me, choose me to serve on a task force of members of Congress as we look at getting out of the current state. And I look forward to providing advice based upon what's going on in Kansas to that effort.
And we thank you for your service and thank you for those efforts. And I know as we won't be sheltering in place forever, that maybe you'll get out of the basement finally. I'm hoping.
Yes, I no longer know what the reason is that I'm in the basement, but I'm reluctant to perhaps to find out.
All right. Dr. Norman, thoughts that you have, especially in reference to Senator Moran's comments, or thoughts of that you also have?
Sure. Yeah, Lee Norman here. Well, it's kind of the story, good news and the bad news. As Senator Moran points out, we've been sorely lacking in testing supplies. There's serology blood testing yet available that's FDA approved, and that will be one of the things that will help to be one piece of the puzzle. It alone won't be sufficient testing. We'll still rely heavily on the antigen testing, the nasal swabs, and then to do more intense contact tracing, either those people that have the illness and then those people kind of in a ring around them, think of it that way. You might have seen that there's a couple of rankings that have us, Kansas, 50th out of 50 states on a per capita basis for testing, and I assure you and the others that it's not like we're hoarding testing supplies or selling them on the black market or something. We are using everything we're getting in the door. Fortunately, there's commercial labs There's hospital labs that have stood up, although the hospital labs have the same difficulty getting the testing materials. That has absolutely been the rate limiting factor. The good news is that we're not doing too bad as a state. When you look at the number of deaths per capita, we're better than 33 states, so we're in the top 17 in the country. And on hospital per capita, we're about the middle of the pack. So again, as per Senator Moran, we do need to uptick the amount of testing so we can earlier identify, and then, you can test till the cows come home, but that doesn't do any good unless you do something about it. And that's why we're bringing on 400 additional people to do contact tracing for routine isolation of those people that we find through enhanced testing. We do have 7 counties that we brought online for community testing. The newest ones will be in Finney County starting Monday and Thomas County starting today. So Colby and Garden City, and they'll be picking up tests from quite a number of western counties.
And I think that's great news. I think the contact tracing is especially good news because as we look at reopening society, our ability to help with any sort of microwave or micro surge in different areas and different communities will be totally dependent, I think, on that, Dr. Norman.
Yeah, it will be. And see, that's a major philosophical switch because now we've been doing all the testing has been ill people. And don't get me wrong, that's critically important, both to test an ill person and then those people around that person and those people around those people that if they are indeed positive. But when you go to do community testing, then it's a major shift that you're testing well people to find out the burden of disease. We've done a little bit of this in the state, and there was one instance with testing just very mildly ill people in a single county. We did 250 tests and came up with 8 positive people that really didn't look ill like they had coronavirus, but they tested positive. 8 out of 235 is a small number, but if you think about the ability of that virus to spread, if indeed each one of those is spreading virus, then that would be quite a number of people that they could.
And so just that's actually a really important thing because if we have that works out to around 3%, if my math's right, of the people in that area, that would have been the community prevalence, just higher than I think we would have expected, especially in maybe in a more rural area.
Now again, these were mildly symptomatic individuals.
Okay,
so
it's a bias, selection bias. But so Secretary, where do you think we are on the curve?
If you look at the rolling 3-day average, it's a slightly negative, a encouraging trend. If you look at a rolling 3-day average, certainly the hospital beds aren't as full as they used to be. Have we rounded the top of the peak and then on the back hill slide for 14 days? We're not there yet. Hence the reason for the governor's extension of the stay-home order until the 3rd of midnight on the May 3rd. But I'm optimistic. Our modeling is spot on in terms of where we thought we'd be. So I'm optimistic that the end of this month is when we'll truly see the peak and then start to improve after that.
Dana, as we look at these points, where are we here at KU today, and what's your sense about this question of reopening and what do people need to do? What do we need to do? Think about that.
So many questions. First of all, at KU, I would echo Senator Moran's comments. We have been somewhat stable as far as number of new admissions, number of discharges. Currently, we have 36 patients positive for COVID in-house. 15 of those are in the ICU. So our numbers are not changing too much. As far as when we open, we certainly echo Dr. Fauci and Dr. Norman. This virus spreads with just such high efficiency. It's hyper contagious almost. We don't know the full prevalence in the community, but how quickly it spreads. Opening, we definitely need to open. We need to get the economy back. We need to get people working. We need to try and help people that are staying at home so they can get out. It does have to be in a very timed and protocol-like measure because you take your foot off the gas, and this virus, this infection could spread like wildfire. And although we are doing really well with PPE right now and ventilators and hospital beds, if there is an explosion and an exponential growth of infections, we could be overwhelmed very quickly.
And just to say, I think I'm going to echo those comments, but first I want to point out about Hawkeye here. There's the Jimmy Kimmel deal that's happening this weekend, this special called One World on the 18th at 7 p.m. It is a star-studded event with all sorts of people, and it kind of to help out there supporting healthcare workers, others involved in the front lines, first responders, et cetera. And I say star-studded, but it has Dana Hawkinson in it.
Right.
I understand that you are to follow like Lady Gaga and Stevie Wonder, and that you're going to be in this as Hawkeye, our own Hawkeye, that is, and you're the first medical interview. So a shout out to Dana, and also to encourage folks to take a look at that. I think it'll be on all major stations. It's going to be live. It's going to be shown all over the world. So that's a big deal, and really a good sign of folks coming together around this. So, and back to Senator Moran's earlier question, this is a balancing act, right? No matter how we look at this, this is a balancing act between making sure people stay employed, which, man, that's good for health, and safe from the coronavirus. So when we do reopen society, the rules around infection control have not changed. And that is the behavior you have to keep. You got to wash your hands. Don't touch your face. Cough into your elbow and maintain social distancing. Those are the reasons we've been able to we've started to bend the curve. If we reopen and people don't follow that and they act like they can do just as they did 2 months ago, then we will still see a surge. Because the number of people who have been affected in our area is still very low. It's probably around at 1 or 2 or 3%. So that means 97% of the people haven't been affected yet. But we have to go back to work and totally understand that. But please do that in a way those basic infection control principles. So, Senator, in response to your question, do we reopen the economy? I am not. I'm a healthcare provider, and I'm not probably the right one to say when is the right time. Clearly, we're going to have to, as a citizen and a personal, just an individual. Man, I have friends who have lost their jobs, and we can't stay sheltered in place forever. But what it has done is to allow us to build up enough PPE and enough expertise, disseminate the knowledge, and be much better prepared for a surge than we were 6 or 8 weeks ago. There is no question it has worked to our benefit. Now it's up to an individual person to exercise good personal responsibility, to make sure they follow the rules of infection control, and help take care of themselves by doing that, and which will take care of each other. That's got to be the message. So it's going to be reopening with personal responsibility. That is the key to a successful outcome. And in the meantime, we're starting to see, Dana, some good news from different trials. I think there was one yesterday about remdesivir that came out. Thoughts about those?
Yeah, I think that there was an article published in the New England Journal of Medicine. I think there was some also anecdotal responses from physicians on the front line treating with remdesivir. Certainly, right now we aren't able to use that drug. It's compassionate use only from the manufacturer, but I think we really need a direct acting antiviral, and that's what remdesivir is. Something like Tamiflu for influenza, it acts directly on the virus, and I think that is where, if we do get a good therapy, that is probably our best shot. Now, we have other things that we're working on as well. There's obviously, everybody knows about hydroxychloroquine or Plaquenil. There is the convalescent sera, meaning people who've been infected can donate plasma, and we can try to take some of those healthy antibodies and other cytokines and chemicals from after recovery and use that to treat. So hopefully our knowledge is getting better day by day, and actually probably moving at light speed compared to past epidemics and past infections.
Yeah. Questions from our media friends out there?
Hi, this is Shannon O'Brien at Fox 4 News. And since it's allergy season, I wanted to know if you all could touch on, the symptoms of COVID-19 versus allergy symptoms. Some of them are similar, I understand, and some are different.
Dana?
Yeah, the CDC website has a very good infographic about this. It is true. It's unfortunately allergy season. Allergies probably are typically not going to cause the fever, the shortness of breath, the chest pain. Also, if you've had seasonal allergies in the past, you understand what it's like. You're probably going to be taking some allergy medicine. The other symptoms that we're also looking for that have been touted are, diarrhea, muscle aches, also we've also heard in anecdotal, or even up to 30%, maybe people losing the ability to smell. So there's all those symptoms which are quite different than people with just typical regular allergies.
Other
What
questions?
would you say to folks who are sitting home and they're coughing and they're not sure, what it is?
They should,
Allergies or COVID.
right, they need to
Yeah.
call their primary
Yep,
care
that was my
physician,
first
and
answer.
if they'll do some screening questions, because if there's any real sign, then they should go ahead and get tested.
Yep.
One of the things that has happened because of limited testing back to Senator Moran and Lee and Secretary Norman, was that we weren't able to test people like that unless you're coming into the hospital. As we get more testing availability, then I think we'll be able to loosen those criteria and test a lot more frequently. That's really important for us to understand how the disease is acting in the public and what we need to do. So lots of appreciation for the support of Senator Moran and working so hard to get more testing, and to Lee Norman. And if you're on the line not talking, make sure you're muting so that we don't hear everything. So other questions?
I've got a question about response from, I guess, anger-filled response. This is Taylor, Channel 41 in Kansas City, and I'd be really interested in any of your responses here, because I have people still responding to things that I put out on social media from these calls or from other interviews that I do. I'm going to read directly one response I got. Less folks die from corona flu than seasonal flu, but journalists don't make that comparison. They're just trying to scare people. I don't know if anger is ramping back up because stay-at-home orders are being pushed back, but I'm interested in any of your responses to that kind of rhetoric we're seeing from a lot of people, that it's still not as bad as the flu. I think that's a pretty common thing that people are trying to continue to push, and I'm curious about what your responses are to that.
I'm going to start with that, but I'm going to turn it over to Senator Moran and to Secretary Norman. The flu has a death rate of about 0.5%. Right now in the United States, we don't know the death rate because we don't know what the percentage we don't know how many people in the public are affected. But I will tell you, I have been in pulmonary and critical care medicine for approximately a very long time. It's been about 30 years. Seen a lot of patients with influenza, have lived through a lot of influenza outbreaks. We don't see this number of admissions coming into the hospital with influenza, nor do we see anywhere near this number of deaths from influenza of people who came into the hospital. It is not comparable. Now, it is true that to date we've seen, I don't remember the exact number right now in the United States, about 20,000 or so deaths, or 25,000. And influenza took about 22,000 lives last year. But we're still at the tip of the iceberg for COVID-19. So they are not comparable. It is not a fair comparison. And I think we have to say it just the way it is, Dana. Any other thoughts about that?
Yeah, absolutely. The mortality or the case fatality rate, let's be clear, case fatality rate has been shown up to be 20 times that of flu. This is not influenza. This is not HIV. We do have vaccine for influenza. We do have treatment for influenza. Some of those deaths with influenza are also because of secondary bacterial infection, bacterial pneumonia. We don't really see that. But it's about the efficacy which this spreads, the number of people affected. And when all of those people are coming to the hospital, or even a small percentage of those people are coming to the hospital and critically ill, that is when you have an overwhelming of your healthcare resources, overwhelming of your beds, your ventilators, your PPE, your drugs to keep the patients comfortable when they are on the ventilators. That doesn't happen with flu, and it doesn't happen all at once either. So those distinctions need to be made. This disease is not influenza. Even though it's an infectious disease, it's just totally different.
Yeah, they aren't comparable. But Senator Moran, it's got to be hard sitting in your position and knowing that, gosh, we have to take care of people, but we also clearly have to reopen the economy. And you see protests in Michigan and wherever. And talk to us about how you strike that balance, because that as an important leader to Kansas, that's got to feel like a pretty big responsibility.
Well, thank you. It is. It is the topic of conversation among members of Congress. It is the topic of conversation to the public. There is an angst about how long is this going to last. I think it's important to note, and I think this may have been said, but the way I would say it is when we compare the number of deaths from influenza That is something that, as it reached its peak, we knew what those numbers are, and we're not at a peak yet, at least according to you experts. So we can't make that comparison saying this is how many died then. We don't know what the consequence is here, and that uncertainty is significant in our health care. It's also significant in our economic circumstances. People are struggling, and I represent a state in which many businesses, their margins are pretty minimal, and often they're struggling to stay in business to begin with. And you add this to the circumstance, and unfortunately, particularly in rural Kansas, but really across our state, the businesses that we lose may never return. And so there is this economic side, and I guess I also would say that as someone who is appropriating taxpayer dollars to fight COVID-19 and its consequences, those resources are not unlimited, particularly with an economy that is not generating tax revenues. Our ability to keep up the level of support that the federal taxpayers are providing, it can't go on forever. And so a measured approach is what I heard you all say earlier, but people are anxious to return. Go back to testing. I think there's a set of people out there who, if the president or the governor says it's safe to return, they will return to work. But there's also a lot of people out there who are still going to be wondering, is it really safe? And if I make a mistake, what are the consequences to my kids or the neighbors next door or my parents if I go see them? And so that, in my view, is where testing takes a high priority, deserves priority, because the certainty that we can take with even the experts, when Dr. Norman or Dr. Fauci says that it's safe to return, they have a credibility but still people are going to have doubts. No offense, Dr. Norman. People want to know in their own circumstance where they are. And so to get us back to a level of comfort, a level of confidence, testing becomes all the more important as we wait for a vaccine. And I would say that I learned this morning from NIH, the National Institute of Health, that they will later this morning announce a cooperative effort between Biomedical Advanced Research and Development Authority, FDA, CDC, the European Medicine Agency, a dozen biopharmaceutical companies pooling their resources today and establishing protocols to move the process forward with development of a vaccine. And so we're putting our best and brightest and a lot of money. This last appropriation bill put $1 billion into NIH's budget for purposes of development, and now the effort is being made to combine government agencies, European interests, and the pharmaceutical industry to get us to a point in which that vaccine is available, perhaps earlier than what we had expected.
Well, that sounds like a remarkable effort. And, I think it's a sign of the times of people coming together that all that can happen in really a really short period of time. So thank you. Secretary Norman, opening Kansas. I know you must be spending hours and hours on this every day, probably about 30 hours per day, just looking at this question.
Yeah, I think we're nibbling at the edges of what it really means, and that one, our healthcare system has to be able to respond. Worst case scenario, we open up and get people moving again, get businesses moving again. We have to make sure that we have sufficient hospital beds, sufficient testing capability, any kind of treatments that are available. And we did not, in the state of Kansas, become anywhere as close to New York, for example, in terms of overly taxing. It's very busy, don't get me wrong, but we need to develop more beds. Senator Moran was helpful for me to make contact with Dr. Stone, the kind of second in command at the Veterans Administration. We have assurances that the VA stands ready to accept our patients and